Cutaneous leishmaniasis treatment with intralesional application of meglumine antimoniate. Criteria for indication of local treatment of cutaneous leishmaniasis in the Americas. 1 to 3 ulcer-like lesions, nodules or plaques of up to 900 square millimeters, 3 square centimeters, the largest in diameter. Lesions located in any location except head and periarticular regions. Absence of immunosuppression. Possibility of monitoring. The application procedure is simple and requires little material to be carried out. The necessary supplies include syringes of 5 milliliters, 3 milliliters and/or 1 milliliter. One needle, either number 27 by 7 or 30 by 8. Gauze, chlorhexidine soap, saline solution, cream such as petroleum jelly or topical antibiotic if necessary. Biosafety elements such as gowns, masks and gloves. Preparation of the lesion. Gently clean the lesion and the surrounding skin with soap or chlorhexidine. If the lesion presents a scab or devitalized tissues, remove them with soap and water. Completely dry the lesion and its edges with gauze and measure the lesion, taking care not to contaminate the surface. If necessary, a 2% lidocaine can be applied with a 5 or 10 milliliter syringe and a 1 milliliter needle for the formation of as many anesthetic buttons as is considered necessary according to the shape of the lesion. From these anesthetic buttons, the needle can be inserted for the infiltration of the meglumine antimoniate. Subcutaneous application of meglumine antimoniate. To calculate the dose to be administered, it is recommended to use a fixed dose of 0.008 milliliters per square millimeter of the lesion area, with a maximum daily dose of 15 milliliters considering all lesions. If the patient has 2 or more lesions, for each one, measurements and calculations are made separately and the volumes of meglumine antimoniate corresponding to the calculation performed are then injected. For example, a lesion with a diameter greater than 30 milliliters and a diameter perpendicular to the largest diameter of 20 millimeters. The volume to be injected each day into the lesion can be done with a single puncher if the largest diameter of the lesion is up to 15 millimeters, 2 punches if the largest diameter of the lesion is between 16 and 29 milliliters, one in the upper pole corresponding to 12 o'clock and the other at 6 o'clock, 3 punches if the largest diameter of the lesion is 30 millimeters, one in the upper pole corresponding to 12 o'clock, another at 4 o'clock and another at 8 o'clock, as shown in the figure. In case of 2 or 3 punches, the volume must be distributed evenly between the punches. Repeat these steps for each injection site for each lesion to be treated. Aseptically fill the exact amount of the drug into a syringe directly from the meglumine antimoniate ampoule. Preferably use a finer needle, 25 by 7 millimeters or the larger 30 by 8 millimeters. Use a syringe with a threaded connection for the needle, since the resistance found to infiltrate the lesion can be large, which can lead to sudden dislocation of the needle with extravasation of the drug. Insert the needle between 5 and 10 millimeters from the edge of the lesion with the bevel upwards at an angle of 30 to 45 degrees in relation to the plane of the skin, and insert it between 0.5 and 1 centimeter, directing the tip of the needle towards the center of the lesion. Suction with the plunger to verify that it is not inside the vessel and begin to deposit the medicine, gradually withdrawing the needle. Infiltrate the medicine slowly. There should be a slight bulging of the skin below the lesion, but it is not necessary to observe whitening or orange peel. Furthermore, if any of these are observed, it is because you are doing intradermal injection, and in that case you must insert the needle a little deeper. The injury should be kept covered with a thin gauze, and a moisturizer or a soft white petroleum gel can be applied. Guide the patient with care and cleaning of the lesion and on possible side effects such as erythema, pain or edema. Please remember, discard the amount of meglumine antimoniate in the vial. It is not recommended to save for the next application, taking into account that it is a material with a high risk of contamination. In case of having more than one patient at the same time, the surplus can be used. The date and the dose administered in milliliters for each lesion should be immediately noted in the patient's medical records. On the day of the administration of the drug, ask the patient about adverse effects and examine the treated area to look for signs of adverse events and to evaluate behaviour.